I am Dr. VP Bhalla. I am the Director for Center for Digestive and Liver Diseases and Head of Surgical Gastroenterology at BLK Super Speciality Hospital. The BLK Super Speciality Hospital is a 600 bedded facility with centers of excellence in various focus areas. One of the centers of excellence is the Center for Digestive and Liver Diseases, and I head this center and I head the surgical gastroenterology team. Our core areas of interest are the diseases of the abdomen, which include liver, gallbladder, stomach, intestine, and pancreas, and the surgical correction of all the diseases of these organs. I have a special interest in pancreatic diseases. Pancreas is a very mysterious organ which is in the posterior part of the abdomen, deep inside the abdomen, and there are very few people who are actually trained to do operations for the pancreas. In my career, I have been a professor at the Armed Forces Medical College for 8 years, and before that, I have trained for 3 years at the All India Institute of Medical Sciences in New Delhi in pancreatic surgery. I have also visited and worked with some of the most leading figures in the world on the pancreatic surgery. Coming to BLK Hospital, we have a special interest in pancreatic surgery, and we in fact have a pancreatic group which comprises of a team of doctors both in medicine and in surgery. In medicine, we have Dr. Vij, Dr. Yogesh Batra, and in surgery, I have in my team Dr. Deep Goyal and Dr. Ravindra Vats. We are supported by a large team of residents, dietitians, anesthetists, intensive care people, pulmonary specialists, and physiotherapists who help us take patients safely through the complicated operations for the pancreas. The common pancreatic conditions that we treat in our hospital are acute pancreatitis, where the pancreas is swollen and it has a lot of complications, and these are young patients who present with life-threatening acute pancreatitis. Then there are patients who have had pain in the abdomen for a very long time, and this pain is classically in the upper abdomen and goes to the back, and when you do investigations, you find that these patients are suffering from chronic pancreatitis. In our department, chronic pancreatitis is evaluated, and then patients are selected either for endoscopic non-surgical treatment, and a majority of them actually land up for surgery of the pancreatic gland. The surgery of the pancreatic gland involves, in chronic pancreatitis, exposing the main pancreatic duct and providing the pancreatic juices an alternative pathway into the intestine by doing what is known as a pancreaticojejunostomy. To relieve the pain which these patients have, we often core the head of the pancreas in what is known as a Fraise operation. Together, a Fraise operation and a lateral pancreaticojejunostomy can give patients with chronic pancreatitis great relief from pain and improve their nutritional quality of life. Finally, perhaps the most dreaded disease of the pancreas is cancer of the pancreas. We have a special interest in pancreatic cancer, and the entire team is geared to safely delivering patients after surgeries for pancreatic cancers. Perhaps the most complicated operation to do in the abdomen is an operation which goes by the name of Whipple's pancreaticoduodenectomy, which means removing the head of the pancreas along with the organs which are lying right next to it, and then reconstructing the whole area so that the patient is rid of the pancreatic cancer and in the follow up can eat normally and survive and lead a normal life. Such operations are done only in the highest trained centers in the city and the world, and our results are comparable to the best results anywhere. We have taken it to the next level because technically sometimes these resections are not done because veins are involved by the tumor. In our center, what is special is that we can excise these involved veins and reconstruct them to make sure that all the pancreas comes out, and we do not deny the patient the benefit of surgery for cancer of pancreas, which incidentally is the best modality for treating such cancers. They can also be treated by chemotherapy and radiotherapy subsequently if the specimen suggests that there is a need for chemo and radiotherapy, and such facilities are also available at the BLK Super Speciality Hospital. In fact, whatever is required to treat pancreatic cancer is all available in our hospital under one roof. We call ourselves the GI surgical team, also goes by the acronym of GIST, GIST. Our special interest areas include the treatment of cancers of the GI tract, and these include the cancers of the stomach, of the esophagus, cancers of the liver and gallbladder, cancers of the colon, rectum, cancers of the small intestine, and cancers of the pancreas. For knowing more about our hospital and for knowing more about pancreatic diseases and how we are treating them at BLK Super Speciality Hospital, I would invite you to subscribe to our YouTube channel. Thank you very much.